Dear friends, the more we know, the little we know. With passing of each day, new things about corona is coming up. Corona is not only affecting respiratory system but also other systems too. Now it is the high time to get into all other systems and find out what is the direct or indirect effect of the corona on that system. This will help us to fight corona better. Today we are trying to see what all effects corona has on nephrology. So we have Dr. Sanjay Kumar Agarwal, Head of Nephrology AIIMS, an editor, member to 16 different national and international editorial boards, member to various national programs and government appointing boards, will be answering to the queries of the family physicians put up by Dr. A.K. Israni, a leading family physician and Joint Secretary at IMA headquarters. Over to you, Dr. Israni.
Thank you, Dr. Divakar, for wonderful comments. And Dr. S.K. Agarwal, I welcome you on this platform of nephrology. In what way, first question is coming up, in what way COVID affect kidney patients? Nowadays, you know it, COVID is prevalent and kidney patients are getting affected. How this is going to affect? Over to you.
There are two ways in which COVID affect kidney. One is the patient is already having kidney problem and then COVID develops in those patients. And second is that kidneys are totally normal, but once patient develop COVID, then COVID affect the kidney. So if we take the first aspect that the patient already has got kidney disease and then developing COVID, if we say that what are the risk factors for COVID related mortality, then commonest is elderly age and second common is diabetes. And after diabetes, chronic kidney disease is the third most important risk factor, which increases the mortality in patient of COVID. Now, this is one aspect. Second aspect is that patient is otherwise kidney point of view, he is normal, but he develops COVID. Now then COVID can cause acute kidney injury directly because of the virus. It can also cause glomerular disease because of the virus. In addition to these, the secondary infection and other complication causing hypotension and other related problem indirectly affect the kidney because of the low blood pressure or secondary bacterial infection. Although as we say that acute kidney injury usually recovers, but now we know that approximately 20% patient of serious acute kidney injury go into chronic kidney disease. So COVID causing acute kidney injury, patient needs to be followed up in outdoor on a longer period to assess that which patient is continue to have a renal dysfunction and is going into chronic kidney disease, because those patients needs to be followed on a longer period, lifelong basis. So this is the two ways in which COVID and kidneys are related.
Dr. Agarwal, if at all end-stage renal disease requiring dialysis, what precautions would you take? Would there be a separate machine or would it be the same with precautions over to the patients?
Okay, so this is a very important question because we have seen that there was a huge problem of dialyzing patient with COVID infection. Now we should understand that COVID is primarily respiratory borne infection and it is not blood-borne. So dialysis machine itself does not transmit infection from one patient to another. Second thing is that the infection dialysis room is a closed room where there are many patients are being dialyzed in that area. So it is because of a atmosphere or the surfaces of the dialysis machine which are factor which increases the spread of infection in the dialysis unit. There is nothing like called dialysis machine or a dedicated machine required for these patients for dialysis. What is important, the ideal situation is that these patients should be dialyzed in an isolation room where the single patient is being dialyzed. But as we know, there are so many hospitals in the country which don't have a space to have a separate room for a single patient to be dialyzed. Now, if that ideal situation is not there, then the dialysis is done for 4 to 5 hours. So in a normal busy hospital, dialysis is done in 2-3 shifts, which means that every 4 to 6 hours, one group of a patient, then second group of a patient for 4 to 6 hours, and so on. So if the unit does not have an isolation room, then the next best step is that these positive patients with COVID are dialyzed in the last shift of the dialysis unit, so that only those patients are being dialyzed, and after the last shift, then the unit is fumigated, and in the morning, next morning, a new shift of non-infected patient can be dialyzed. Now, if that is also not possible, then the third step is that if you have got a very big unit and say 20, 30 machines, so you can put a patient in the corner of that huge room and can dialyze simultaneously with a COVID negative patient. But then one has to take a very strict precaution that the nurse or the technician who is dialyzing this patient in a corner, he should not mix up with other patient or does not handle the instrument and other thing of other patients. So these are the various ways that the COVID positive patient can be handled in a dialysis unit.
That's perfect, Dr. Agarwal. Let me ask you now, in case patient is requiring a transplant of the kidney, does this patient what are the guidelines? Does this patient should wait, or would you take these patients in COVID times, earlier the better?
No, you see, in a patient of end-stage kidney disease who needs transplant, obviously transplant is the best option as compared to dialysis, both in terms of a long-term survival as well as the cost of treatment. Transplant is cheaper than dialysis. So every patient we wish to transplant as early as possible. But we should also understand that transplant is rarely an emergency operation. It is an elective operation. And in COVID situation, there are many angles related to getting a transplant done in a COVID period. Number one, there is too much staff of anesthesia and other manpower is shifted to COVID area to handle the COVID patient. So we have short of OTs and short of anesthetic staff, which can do other surgery like transplant surgery, which is a elective surgery. Second thing is that the transplant patients are being prepared before surgery with many immunosuppressive medication, and some of the patients even need plasmapheresis and other medicine which are costly. And the transplant requires that within 48 hours, the patient should be tested with COVID test and he should be negative. Now see, if we have prepared a patient for last 10 days with costly medicine and giving other medication, and last moment he comes out positive, so everything what we have done in last 10 days goes waste. So second thing issue is that the manpower, we don't have a manpower in a busy hospital, particularly which are COVID dedicated hospital. Third thing is that the area of the transplant where patient is operated as well as pre and post transplant area should be COVID-free area. So if the hospital is dedicated to COVID, so we don't really find a COVID-free area in the hospital to keep the patient safe before transplant. And the last thing is that we have seen in our hospital also done everything, transplanted patient, and third day patient is found to be COVID positive. And COVID being infective disease, then we have to handle the immunosuppression very critically, balance the rejection versus aggravation of the infection. So considering all these things, our recommendation is that if the hospital can arrange a COVID-free atmosphere and they have got adequate manpower, then they can go for an elective surgery, provided the government and the policy maker are allowing elective surgery in the COVID era. Otherwise, probably better will be let the burden of COVID go down in the society, and hospital has got a manpower and clear area from COVID, and then the transplant is done. That will be a better approach.
Renal failure patients, you understand that they are the immunocompromised patient, and mucor mycosis is nowadays coming in a rampant way. How do you take these patients into going into mucor mycosis or black fungus? What is your take on it?
So yeah, but yes, we were already facing COVID issue, and on top of that, this became a very important issue of a complication of COVID. Now, there are many issues related which in media are coming. So I just want to clarify some of the important issues. Number one, that this treatment and the outcome of mucormycosis is far more poorer than the COVID itself. If we take a average mortality of COVID somewhere 1 to 2%, mortality of patient with mucormycosis is somewhere 20 to 30%. And the best approach or the outcome of mucor is only possible if the diagnosis is done at a very early stage. So currently with so much common mucormycosis in society in various hospitals, there should be a very high index of suspicion so that the diagnosis can be done very early. Second important thing is that the medicine which are used for mucormycosis, which is amphotericin, is the main medicine. Now these medicines are costly and there are various types of amphotericin. So the two common toxicity of amphotericin is nephrotoxicity and a low potassium. Now these two has got a limiting factor for giving adequate dose of amphotericin so that patient can be treated. Now if we use larger doses, then there is a kidney damage, then we need to modify the dose and maybe temporarily stop, and then we cannot treat mucormycosis. On other side, second complication, if the potassium is low, then many of these patients we have to check regularly, and if it is not corrected properly and early, it leads to difficulty in withdrawing the patient from ventilator, because low potassium causes muscle weakness, so patient cannot be kept. Weaning of patient from ventilator is become difficult. And third thing is that the mucormycosis requires two treatment, usually amphotericin as the medical treatment and local surgery and debridement as a additional important factor. So unless we diagnose at the early stage when the disease is limited to the nose, the debridement is easy. But imagine if it spreads to the eye and the brain, then the surgical debridement of the eye and the brain is not easy, because you can't remove a significant portion of the eye or the brain. So then the treatment of patient with amphotericin goes much longer. And the last thing is that amphotericin usually requires 2 to 3 weeks of treatment, and it is injectable treatment. So if patient develop this, then we need a patient occupying bed for 2 to 3 weeks in the hospital. And while one side we are already having shortage of bed, just for giving injectable injection, somebody is occupying beds, then we need to be prepared for those additional bed in the hospital. So mucormycosis keeps a very complex situation from administrative point of view as well as from nephrology point of view.
My last question coming up to you, Dr. Agarwal, regarding the precautions a renal patient should take specifically in COVID pandemic times. What are the take-on messages and take-on issues for the renal patients?
So these patients, there are many kidney disease, but on this issue, I will restrict to patients who are on maintenance dialysis and who are on a transplant patient. Now, these two type of a patient require a very frequent visit to the hospital. And currently, if somebody is required to visit frequently in the hospital, he is at the risk of acquiring infection of COVID in a hospital setting. So these patients should basically do teleconsultation, and most of our hospital currently doctors are doing teleconsultation. So they need not to go to the hospital on a frequent basis. Obviously, a dialysis patient we cannot avoid, because he has to go to 3 times in a dialysis unit for getting dialysis. So my suggestion to these patients are that they should follow the treatment very strictly so that they do not land up into emergency. Because in current situation of COVID, if somebody land up into emergency, then there is a lot of problem of handling these patients, getting a test done for RT-PCR in the emergency, and then keeping them in a COVID area. So those becomes very difficult. So our advice to these patients is that they should follow very strict diet protocol and the fluid and the potassium in diet, so that these things does not make things emergency. Now transplant patient need very specific immunosuppressive medicine, and in these time period when there is a lockdown and a specific group of medicines are not available in the market, we suggest transplant patient to keep the good stock of medicine so that they do not miss medicine and do not rush for getting a specific medicine in the market once there is a lockdown, and they continue to take immunosuppressive medicine and their transplant functions normal. So the best advice is that follow your doctor's advice, mostly on teleconsultation. Keep a enough staff of dialysis consumable and the transplant medicine so that you do not land up into emergency and follow your treatment very strictly. So if these things will be done, they will not face emergency situation, which in current scenario is not a very good idea to handle.
Thank you, Dr. Agarwal. Wonderful deliberation. Over to Dr. Divakar.
It was a wonderful session. I congratulate Dr. Israni for putting up direct questions. And I want to thank Dr. S.K. Agarwal for enlightening us with so much information in such a simple language. I once again thank you for such an informative session. Thank you.